the heart of Yorkshire.
Redford.
Hello, Barnsley A&E.
An unbeatable team.
1, 2, 3.
Hard at work 24 hours a day.
I feel like I'm on Titanic and bows just lifting up out at water.
7 days a week. Saving lives.
Hands across your chest, Mary. We've got you,
Helping loved ones.
I'll have you looking beautiful again.
Didn't expect to be losing part of my body today.
Making the community they serve better.
I thought I'd do it up.
Oh, you're okay.
All staff's been brilliant.
A health service treating anyone
You'll need to see a doctor.
He'll find out that I'm an idiot.
and everyone. A team doing anything and everything for each other.
Sweetheart. Hey.
This is Barnsley Casualty 24/7.
The National Health Service might not be perfect, but thank God we've got it.
Another life saved.
On shift tonight,
Hello, A&E sister.
Sister Abby,
This is the last bed in the hospital. My optician did this to his finger chopping wood.
emergency nurse practitioner Claire,
That's sticking up like a sore thumb, that is.
That belongs up there.
consultant Dr. Dave Walker,
Certainly made a proper mess of it.
and
Hey guys.
Yeah.
Just gonna put a dab of glue on.
Nurse Greg.
To mummy. Yay!
Well done.
So,
All right, mate, all right.
get ready to share a shift
If I don't get these back within 15 minutes, I'm going to hunt for you.
with the team at Barnsley Casualty. It's the start of the day shift at Barnsley Hospital, and ambulances are flooding in.
We've got 1, 2, 3, 4, 5, 6, 7, 8, 9 ambulances here. Usually it's probably 3 or 4, and then more come in as others are going back out again, but these are just at standstill.
Hello. Just one sec.
In the hub, Casualty is gridlocked, and Sister Abby is in charge.
At the minute, there's 37 patients in the department and there's 12 that are waiting for beds on the ward. There's just no flow through the department or through the hospital at all. Classic shift these days, not having any beds in the hospital. Trying to juggle people at the beginning of the shift in the morning when you've only just woke up.
Sister Abby needs to get the department moving fast.
The triage staff are aware if we need to bring a patient in that needs more urgent care, we can what we call pre-alert and ring ahead.
And it looks like one of those priority patients is on the way, with suspected severe cellulitis.
All right, John.
Yeah.
78-year-old John is also paralysed from the neck down. His carer dialed 999 when John's foot became swollen and inflamed overnight.
That's not normal for him, is it?
No. Like I say, he's been on the doxycycline. She said she was concerned this morning because he seemed a bit more confused.
In cubicle 4, carer Laura catches up with John, and advanced clinical practitioner Richard assesses him.
Hi, John. So I'm Richard, and I'll have a good look at you today, so that's okay. You're tetraplegic from a car accident when you were only a young man, really?
Yeah.
24. Are you hoisted out of the bed or do you stay in bed?
Oh, those, get out of bed.
You get into a chair, do you?
Give me too much.
Yeah. Okay.
I love working at Barnsley. I've done now for 16 years.
And what's been happening, John, then?
I keep getting this, what do you call it?
Cellulitis, then?
I broke my arm when I was 14, went into hospital and come across a male nurse. And I thought, nursing, is this an option?
When did you last have it? Before? When was the last time? Quite a while.
I'm getting to be one of the older end now, and I don't think I'm going anywhere soon.
Let's have a look at this leg of yours. Okay. So this is a good leg?
Yeah.
Okay. And then this is really angry. And when do you think this started?
It came up on Saturday night.
That's quite red and inflamed, that, John, okay?
Yeah.
Cellulitis is a skin infection that can spread deep into the body and, untreated, may be life-threatening.
Sharp scratch, I'm so sorry about this.
The team need to stop the infection spreading, and fast. With the ambulance bays becoming a parking lot,
We're just parking wherever we can get a gap, basically. All the ambulance bays are full, and we're now parking on the roadside.
Sister Abby needs to get more patients through the department.
Just come this second.
Oh,
Just to see her from. No, we ain't come to take her.
Oh.
Still no bed.
At the minute, the department's full, so we've got nowhere to bring the ambulances into. So we've got a couple of patients on the back corridor, and then we can have a couple of patients in the back of the ambulances still.
And another Barnsley resident is being rushed in, who will need to go to the front of that queue. Dr. Walker preps for the emergency.
Yeah, she's 9 out of 10 pain again.
37-year-old Stacey's badly injured her arm after being thrown from a horse.
Ready, steady, lift.
She's going to drop this arm. Okay. Is that okay? She's been riding a horse in the field. It's been bucking. It's been a little bit of a hill. The horse has slipped and she's fallen off to the left side, rolled over.
So where's your pain? And it,
Probably arm,
to your arm, and where else?
probably elbow to my finger.
To your wrist. You got some pain there?
No, further down.
Further down.
Yeah.
I'm sure as you can guess, you've broken your arm.
Yeah.
Yep.
We're going to get you some strong pain relief. I know you've had some things already, but things work in different ways, okay?
So I'm just feeling.
Have I ever took a little drink? Ah!
Is that your wrist that's bothering you? Yeah. We'll get you some pen. We'll get you some to breathe in. The Barnsley people, I mean, they're quite stoical, and they don't make a fuss.
So nice, deep breath.
I hope that the people of Barnsley think we're a friendly, caring department who show to the patients that we care.
Stacey's severe pain means the damage to her arm may be extensive.
Yeah. Just do a move into resource next door.
In Rhesus, she's reviewed by an orthopaedic consultant.
You feel me touching you there? Can you feel that? Can you feel that?
Numbness may mean she's also damaged the nerves in her wrist.
Well, let's get some x-rays, okay?
Untreated, Stacey could lose the use of her hand, so she needs to be urgently assessed by a specialist surgeon. There's gridlock in the ambulance bays.
There's no beds in the hospital, so there's nowhere for them to move these patients, so it just cascades down to us guys.
It's all hands on deck in the hub.
Are you happy with any kind of wound gluing, things like that?
As Sister Abby and the team try to clear the patient backlog.
We like to get them turned around within 15 minutes of them being here, but it's not always the case, because at the minute, the department's full, so we've got nowhere to bring the ambulances into. You do feel the pressure quite a bit when you know that there's ambulances queuing on the back corridor as well as outside, because obviously you don't know what's wrong with these patients and they need to be seen by a doctor.
One of those needing urgent treatment in Rhesus is Stacey.
What's your pain at minute? 10 being the worst pain. 9.
She badly injured her wrist falling off a horse.
Just breathe, breathe, breathe. I'll grab my hand, do whatever you need to do.
Stacey's friend Sam was first on the scene.
I got to her and she was writhing around in pain, and I laid on field with her for about half an hour. It's not nice seeing your mate in pain.
Dr. Walker reviews her x-rays.
That belongs up there. So the whole of her hand has gone that way. So it needs putting back in place and moving. So it is quite a bad one. Certainly made a proper mess of it. Stacey's going to have some pain relief and then we're going to pull it, try and get it back into a better position.
A little scratch.
Stacey is given an anaesthetic, ready for the procedure.
Just a bit of pressure, is it just...
Oh, no, it's burning.
That's going to numb it off soon, okay?
You are so brave, mate. That's the first time I've ever come close to passing out. Wow.
If the manipulation of her wrist doesn't work, she may need surgery to correct it. Ambulances have been queuing to get into Casualty since first thing.
We do our best to try and keep that backlog to a minimum, but the last time I actually saw it this busy was around the Christmas period.
Hello, it's only our bit sister down in A&E.
In the hub,
I'm just wondering if the bed is ready.
Sister Abby's trying to make space
Are you wanting this trolley?
to get more patients treated.
So when it's busy, it's a lot easier for us to just help out with bits and bobs like this, because then another ambulance can just come straight into it once I've finished. And it just helps with the flow of the department then, doesn't it? Since we've no room at the inn.
Doing her bit to reduce patient numbers in minors is emergency nurse practitioner Claire.
James?
32-year-old electrician James injured his hand at work.
What's happened to you then, James?
I managed to chop the end of my finger off.
OK, what did you chop it off with?
It's a piece of chipboard flooring which I was trying to cut a hole into, only managed to cut two sides and tried to open it up slightly, and it's closed back down on itself and just chopped it off.
And who's this that you brought with you?
This is my stepfather who was working with me, Terry.
He's supposed to be looking after me.
OK, press onto there again for me. We're called minor injuries, but in actual fact, it's not minor injuries at all. So these are the gloves that it was in?
Yeah.
Yeah?
So luckily it caught whatever was left.
Unfortunately, it's avascular, so no blood supply to it. So I don't think that that's reattachable, to be honest.
OK.
We will see anyone that comes in that's got an acute injury within reason. So what we'll do now is send you around for an x-ray.
OK.
We manage that patient and every aspect of their injury and how they are then going to continue to manage their life in the short or longer term, dependent on their injury at the time.
Amputations can lead to infection and lingering pain.
Yeah, all finished.
James may need surgery to repair his fingertip.
Belle, you know your patient in Fanero?
Yes.
Are we still waiting for a response from them?
Yes.
In the hub, Sister Abby's shift is grinding to a halt.
So at the minute we've got 52 patients in the department, 13 that are waiting for beds on the ward. So in terms of people moving, nobody's moved. If we've got a lot of patients waiting for a bed on the ward, we don't know what's happening on that ward. They might have patients who are needing one-to-one care, so that takes a member of their staff. So every single department within the hospital has a knock-on effect of each other.
Trying to reduce the wait times in majors
John, I'm just going to try and get the tube.
Bend your arm to give you some antibiotics.
is advanced clinical practitioner Richard.
They said they've had to use the machine before, have they? The ultrasound machine.
He needs to give John intravenous antibiotics. to stop the cellulitis in his foot spreading.
Trouble is, when I go to sleep.
I know, you can feel that. I'll have a look and see where we can get one.
Yeah.
Some people with medical conditions who have lots of blood tests or just got poor circulation can have poor veins, and finding them veins can be difficult with normal conventional methods.
So you prefer me back your hand anyway?
Yeah, well, I can't feel it, see.
Yeah. That's always a bonus, isn't it, I suppose? Keep your arm still about there for me. You're a bit difficult, aren't you?
With the ultrasound, you can actually see the structures under the skin. You can see where the arteries are and the veins are and where the nerves are.
Yeah, I think we're in there, my friend. Get some of this jelly off, because our dressings don't stick very well to it when we've got the jelly on.
No. I wondering if it's the gel that makes it stick so much.
It's probably the needle. I'll get my colleagues to come and give you some antibiotics through this tube, okay?
Yeah.
Okay, I'll see you in a bit, my friend.
Yeah, yeah.
This is some flucloxacillin, so this is just an antibiotic.
Yeah.
And then once this one's finished, we'll pop this other antibiotic up as well.
Yeah, okay.
We do like to manage complicated patients. They are a challenge. It's not always about diagnosing the problem, it's about making sure that they haven't got anything life-threatening or serious. And if they have, then we need to stabilise these patients for transfer and referral on to the specialities involved with their care.
What we need to do with you today, John, is I don't think it's safe to let you go home. I'll speak to the medical team and we'll get you upstairs and get you into a proper bed as soon as we can, okay?
Yeah.
We'll keep you comfortable best you can, we'll keep turning you. If there's any concerns while you're here, just let me know, okay?
John had to stay in hospital for 5 days. He's now back at home, where carer Laura is keeping a watchful eye on him. With a bay freed up in Casualty, another patient can be brought in, so an ambulance can leave. But there are plenty of walk-in patients today too. And one of those has come into the paediatrics department.
Have a seat, lovey.
Nurse Greg's next patient is just 20 months old.
What's happened, my love?
We've just been in cafe and she tripped over her own feet and went into skirting board, like right on corner.
Mum Libby and Nanny Gina brought little Esme straight into Casualty.
Did she cry straight away, Mum?
Yes.
Lovely. And has she been sick?
No.
Lovely.
Student nurse Kissimer helps with the initial assessment.
Can I please check your temperature now? Good girl. It's not gonna hurt you at all.
No.
Hold on. Oh, Mrs. I know, I'm sorry.
Very soon. 35 12 minutes.
It's fine.
Well done, see?
I find it very privileging in nursing when you can do something to help. So a child comes in poorly, you can impact on, give a treatment. I'm gonna peel this plaster a little bit, have a look and then pop it back over, okay? I just have to think this is the job that I want to do. It is tough, but we're here to help people and that's the people need the help. Okie dokie, that's fine. Lovely. Have a seat in waiting area for us.
The team need to urgently check if Esme's head injury has caused a fracture to her skull.
Put your shoe back on and come over.
Ambulances are still waiting.
I think there's very few beds available from the message that we received earlier.
For treatment bays to come free. And in the hub,
I hope the shift gets better than this.
Sister Abby has a new problem.
Went off earlier and it said like not uploading, blah blah blah. You know when it gets the red banner?
The clinical computer system has gone down.
It's where you put all the patient observations on. So now we're having to put them on paper, which that's what they're doing at the minute. It's a massive issue. It's quite common for the nurse in charge to be juggling a lot of issues at the same time. You got notes in ADC too? No. So we're just going to go and photocopy them. I can't find them. It's just a constant juggling act and finding the balance of where you need staff to concentrate. Perfect, thank you.
Computer glitches won't stop the team from clearing the patient backlog. Over in Resus,
Are you getting any numbness or tingling anywhere in your hands?
Tingling a bit.
orthopaedic surgery registrar Suhaib Takir is going to try and manipulate the bones in Stacey's wrist back into place.
Most of it is just going to be letting things relax, pulling things, it'll just be gentle. Just try and get it into as good a position as I can, and then hopefully that'll be more comfortable. Gonna have a look all the way around, make sure there aren't any wounds or anything.
That's it. Suck on that. That's it. Well done, mate.
Friend Sam supports Stacey through the procedure.
All right, mate. All right. Yeah, well done.
No, we couldn't hear you.
A plaster cast helps keep the bones in their right position.
Big deep breath of that if you need to. That's it. Well done.
Does your fingers feel alright?
A lot better.
Did it?
Like, I want to move them back.
Fantastic. That's a good sign, isn't it?
Yeah.
I couldn't do that earlier.
I know.
Since we've been hopefully we've relieved the pressure on the nerve that was there. Now, can you do the OK sign for me with the left like that? Fantastic. Don't let me pull out. Excellent. Can you spread your fingers out like that? Don't let me pull this in, push this in. Good. I strongly suspect we're going to need to do an operation here, but before we kind of go into that, we'll get a repeat X-ray, see where we're at, talk about things. Okay?
Stacey's care is being overseen by Dr. Walker.
How are you feeling?
Alright, a minute. A bit more sensation, fingers up.
Good, good, good. Fine, okay. Is that still working or?
Yeah.
Yeah, good. Keep using it if it's sore.
An X-ray will show if the manipulation has been a success.
Alright, Stacey, am I alright to put your arm into this board here? Is that alright? That's it. Put that down as flat as you can. You'll be able to turn it from the shoulder.
If the bones are still out of place, Stacey will need surgery on her shattered wrist. In the hub,
The computer's working now.
the computer system is back online.
We're in. We're cooking on gas. Gonna sort my life out now.
But what's not sorted is the ambulance car park outside.
There's quite a lot of queues. People actually waiting in ambulances to get onto corridor.
Sister Abby doubles down on efforts to clear the backlog.
So at the minute, with those 12 people that are down here, that means that there's 12 people that can't have a cubicle. So although we're still accepting people coming into the hospital, they'll have to sit in the waiting room. They can't have a cubicle if they need one.
One of those hoping she can be moved out of Resus is Stacey.
Right, I'll see you later.
Son Callum and husband Scott have arrived to support her.
You do not want to see what she just went through.
I was getting a little bit excited, even though I were only walking, and decided to bronch me a few times, so eventually I fell off. I tried to sit as long as I could, and then I think my body just gave way. Grass.
Come on, my girl, man, the word.
She followed the right.
See if I need an operation or not. Look at Bro's bottom, mate.
It looks a lot better than what I thought it'd have been. I could hear her screaming out for
Stacey is well enough to be moved out of Resus, but a decision about going home is up to orthopaedic surgery registrar Suhaib here.
Looking at the repeat X-ray, it definitely looks better. It's in a better position, so that's good. Here, you can see we've restored the length, so it's a bit closer to where it should be. Realistically, it's a significant injury that may have long-term effects kind of going forwards. Hi, Stacey, okay. Right. So essentially, you've got a really quite nasty injury. And what we usually do when we fix wrists is use a construct using a plate and screws, essentially, to hold it into the best place possible for the bones to heal, so that hopefully you can get the best function out of it. The operation would involve risks, benefits, and obviously it's your decision as to whether you feel that you'd want to go through with that. Is that all right?
Well, if you need doing that.
Yeah. So I'm happy to let you go home. If at any point you notice that things are getting worse, your symptoms, you know, that tingling and things come back, you need to come back to A&E, because it may mean that... Have you? Okay. Has it come back? Okay. I'm tempted to say that we bring you in, keep your arm nicely elevated, because that'll probably be the swelling that's causing it then, and then take it from there, make sure that you're comfortable. Shall we do that? Yeah? There's a lot of swelling in and around the wrist now, so the key is to try and get it elevated, to let gravity do its magic in a way and reduce that swelling. But it also means that we can keep an eye out for it, because if that does get worse, we may need to consider further intervention a bit sooner.
Hello, A&E sister.
But first, Sister Abby needs to find Stacey a bed.
36, lovely. Thank you very much. Bye. So we've got a bed. Just the one, but I'll take it. She can go toward 36. I've requested a porter and everything, so just need all the notes and stuff. Yeah.
36.
Stacey was admitted to a ward. She had an operation to repair her wrist, but suffered some permanent nerve damage. She's now back home recovering. Another cubicle freed up means one more patient can be moved off an ambulance and into casualty. But Sister Abby needs to speed up the flow through the department.
No matter how many patients you get out, the patients are always going to be coming in. So sometimes it's like trudging through mud.
Helping to get the shift back on track is Dr. Jake Mullen.
All right, nice to meet you, Jeremy. I'm Jake, I'm one of the doctors.
51-year-old former professional rugby player Jeremy has painful swollen knees.
We have both just had COVID and he's still not got rid of his bad chest.
We're still under you guys at the moment.
And it's still been investigated for it.
So when did you first notice the swelling?
Just through evening.
Yeah.
I've not had a wink of sleep.
I'll start with this one if that's okay. I'll try not to. And that's all okay, but it's at the front there. Oh, sorry, I didn't mean to. In a patient with new joint swelling, one of the things I'm most concerned about is something called septic arthritis, which I need to rule out. It's an infection of the joint.
Thank you very much. I'm an ex-professional rugby player and it's the worst pain. I don't go to doctors for nothing. The thing is, I stayed up all night.
Let's get you through.
Thank you. Yeah.
Dr. Mullen moves Jeremy to cubicle 2 for a closer examination.
Put your heel towards your bottom.
No.
If you can, do the most you can. Yeah?
No.
Okay, so you can get to about 30 degrees. Same with this side. What's the most you can?
Less.
Less? What about on this side?
Yeah.
Okay. So, Jeremy, the thing we get really worried about when people come in with swollen joints that are inflamed is infections in the knee. Usually you'd be quite unwell with it, which is why this, this recent illness is kind of making it even more difficult for me to tell exactly what's going on. And I'll probably want to get some X-rays first, because that might help me make a decision as to what's going on.
Septic arthritis is a serious joint infection.
Right, so just turn in at your hip for me. My hands are really cold, I'm very sorry.
Untreated, it can cause permanent damage and may even be life-threatening.
There we go. That's one.
If confirmed, Jeremy will need to start treatment fast.
I'm just ringing regarding a patient coming up to yourselves and wondered if the bed was ready.
There's finally some good news for Sister Abby.
They'll give you a handover when you get up there. Thank you, bye. Wonderful. Slowly but surely, the beds are coming up. We've just had one and then another one's just come up now as well, so we can get these gone. If we've got a lot of patients waiting for beds and one becomes available, you feel like you've won the lottery.
The priority now is keeping a good flow of patients through the department. And in minors,
about half the nail and the tip of the finger, just all down to the bone, yeah.
James and stepdad Terry,
That's the finger.
are hoping for good news too.
I've got 3 usable fingers. Or 2.5. Oh. Wow, look at that.
Idiot. Could have been worse, though.
Could have been.
It could have been me.
Emergency nurse practitioner Claire assesses James's x-rays.
This is the middle where the end of the tips come off. And there's no bone involvement. Good news, no bony injury. So we'll have a better look at the finger end now, all right? So what we want you to do is lift your fingers up one by one for me. So that one first, that one, and that one. Wonderful. And then can you feel me touching you?
Yeah.
Are you married?
Not yet, I'm engaged.
Oh, well, you need this finger to look right then, don't you? You don't want to be offering a hand out like that, do you, for a ring putting on it? So what we need to do is refer you to Sheffield, to the hand surgeons, and then what they will do is assess this and see what kind of procedure they can do for you.
Okay.
You're very brave.
Didn't expect to be losing part of my body today.
Can I refer you a gentleman, please? He's got an amputation sort of halfway down his nail, but he has got the palmar aspect of the finger end. I've not always worked in accident and emergency, but I've always come back to accident and emergency. So if you just take it up to there and just give it a good swish in there for me. Every day you're going to see something different, which means that you're never going to get complacent.
That feels weird. Trying to touch with it.
My optician did this to his finger, chopping wood for his log burner. and he were fine. He were back to normal in a couple of weeks.
Oh, good.
Yeah.
That's what we'd like to hear.
Right, I'm just nip and get you a tetanus then, all right?
Okay, thanks.
That's sticking up like a sore thumb, that is.
Tetanus. Top of your arm, my darling.
Thank you.
Just nice and relaxed for me.
Okay.
Okay, all done.
That it? Thanks for your help.
All good. Take care.
Thank you.
Thank you once again.
All right, bye-bye.
There's a lot said about hospital, but every time I've been to here, they've done really well, looked after us, been relatively quick.
It's been very quick. Straight in, so I'm really pleased.
And we got no parking tickets, so that's good.
That's always a bonus.
James had an operation to repair his fingertip the following week. It's healing well, and his hand should look good enough for a wedding ring before too long. As ambulances start to move again,
The crews are basically working flat out as they normally are.
and those waiting can be brought in,
By the pool bed then. Oh, have they pulled it?
in the hub,
Hello, it's only Abby down in ED.
it's giving Sister Abby a different sort of problem.
I know you're probably already aware, but I just wondered for my documentation, you know the 2 trolley breaches that are coming up at 2:53 and 2:58? It can get a bit confusing then once the beds come up because people are coming and going all the time, like Spaghetti Junction. What have I got these in my hand for? I've got 4 patients going up to the ward, 2 going to CT, 3 for X-ray, and then the 2 ambulance bays need moving as well. So, yeah, it is sometimes like Spaghetti Junction when you've got patients going here, there, and everywhere.
Patients are moving through paediatrics too.
Oh, we got Esme. Come on, sweetheart. Have a chat with Mummy. Yeah? We'll see which room we've got free.
The team are keeping a close eye on Esme's head injury.
Want to have a seat in there for us, Mum?
A treatment will be decided after a review with trainee advanced nurse practitioner Gemma.
Hi. Hello.
It's okay.
I'm sorry, sweetheart. Can I have a look at your hands? No. No. So the fact that she's pulling away makes me... Oh, I'm sorry. And is this what she would normally be like?
Yeah.
Yeah. Kiddo. So we can definitely tell you're using your arms properly, can't we?
She knows you're going to touch it.
I know, I know. Do you think she'd be moving her neck as normal?
Yeah, yeah.
You're ticklish. Yeah.
Yes, you are.
You are, right? Yeah.
You feel better?
I know, I'm sorry, I'm sorry. I am going to have a little feel, sweetheart. Do you want to pull her? I know, I'm sorry, darling. Actually feels all right. Can't feel any sinking in, which would suggest like a fracture or anything. I think it's probably just going to need a clean and a little bit of glue. Okay. All right. I know, sweetheart. I'm sorry. I'm done. All done. All done. It's difficult in children because there's set tests you can do, but in children you've just basically got to judge how they are behaving. So that's why it's important to ask Mum, are they behaving as normal? Is there anything out of the ordinary? And the fact she was trying to push me away, she was cross, she was moving all 4 limbs equally, and she was turning her neck and everything suggests that I'm not worried about her neck or things like that.
Yes, Jem.
Hello. So, got a little 20-month-old, Esme. I've had a look in her ears, there's no leakage or anything coming from both ears. No septal haematoma that I can see.
And does the scalp lac need anything doing?
I think it's just literally going to need a little bit of glue and then home, we advise.
No, that's fine. So just home with head injury then.
Lovely, thank you. I can let her know.
Esme needs the deep cut on her forehead closed. But for a toddler who's having a bad day, that might be tricky. The ambulance bays are finally clearing.
All 6 bays have been really well utilised all day long. Patient demand is quite high today, but it's part of the nature of the beast. It's what we do.
But in the hub...
What were I doing down this side then? Can't remember.
Sister Abby is still dealing with the fallout.
Are you happy if I ring the ward to see if they're ready to...
Yeah, I'm just chatting with the reg.
Oh, this old chestnut.
Staff really look after each other down here. Teamwork is a major part of A&E.
So you got 3 bottles all day?
Oh, I forgot.
At the moment you've got Tom, Big Phil.
Lovely. Teamwork's the only reason how we get through the shift. Without that, I think it'd all go a bit manic out there.
Keeping things calm in paediatrics is Nurse Greg.
Where is she, Jem?
She's in Unicorn.
Lovely.
Esme's head wound will need to be glued.
Hey guys. I'm just going to put a dab of glue on. It's probably best if we lie her down.
Yeah.
And then we can just...
Sleep.
If she moves her head, unfortunately, we are going to have to hold it just to stop the glue from running anywhere near her eyes, okay? Yeah. Olivia's coming to try and get some distraction techniques, all right, so I won't start before that.
Play leader Olivia needs to keep Esme occupied.
Oh, wow. What have we got here? Oh, do you like bubbles? Yeah. Oh, we've got some bubbles in here. We've got some fidget poppers. Have you played with one of those before?
You have, haven't you? You've got some at home.
Often children come in with quite serious injuries and they do need quite a lot of distraction. You've got to be very fun, very energetic, very exciting, just to kind of make them kind of intrigued and make them interested in you. We got loads of little bits in here. What else have we got? See what else we've got. You're okay.
Can you just hold her hand for me, Mum, just a second?
Oh, what's that? Look at that. Oh, you got Mummy. You got Mummy.
Try again. Front to Mummy.
Yeah.
Well done.
Front to Mummy.
Well done.
Yeah.
Yeah. Oh. I do reassure the children. They come in quite scared, but then they can leave on a high.
Bye-bye, Mrs. Thank you for being so good.
Would you like a little teddy for being extra brave? It's a very rewarding job, I would say, because you go away from it knowing that you've achieved something, that you've made them happy, and it's a good feeling.
Esme! Oh, I've got you a little prize for being extra brave.
What do you say?
Would you like a little teddy?
What do you say? Thank you.
And then you got a little certificate to take home. Be careful.
Oh,
Bye-bye.
thank you so much.
No worries. Bye-bye. Let me go home.
Esme's head healed well, and the teddy bear is a new favourite.
Bye.
Karen. Karen.
If I don't get these back within 15 minutes, I'm going to hunt for you.
With the ambulance bays clear, Sister Abby's shift is finally looking up.
He was, can I borrow your thing? They go, yeah, give me your phone.
Yeah.
He would take your phone off him, and then give him your scissors or whatever else, and you would keep his phone until...
Well, yeah, that's a good thing. It is sometimes like wading through mud during shifts. You can discharge 10 people, but 12 book in. Real sense of achievement when we've got perfect flow through the department. Phil's picked it up, so wherever Phil is, he'll come back and take it. You can't miss him, he's about 10 foot tall, isn't he?
It's looking positive for Jeremy too.
Jeremy?
Dr. Mullen has his X-ray results.
All right, Jeremy. So, I couldn't see much on your X-ray, to be honest, which is reassuring. Yeah. This is most likely caused by an inflammatory condition. Typically, it can happen after like a viral illness, like the one you've had. So what I'm going to do, I think you need to be seen by a rheumatologist, doctors who look after joint problems.
Okay.
Given the fact that it's happened after an infection, it's both his knees, it's much more likely this is an inflammatory condition, which is usually managed by rheumatologists who are joint doctors. So I've arranged for him to go to an ambulatory ward where he'll be seen there, and hopefully they might be able to figure out exactly what's going on.
It's down there, so the doctor can see you there.
Okay. Painkillers have kicked in, so I am able to walk. Yeah, it's not no miracle cure.
Jeremy was given medication to reduce the swelling and allowed home. He's now back enjoying his rugby. Order has finally been restored by Sister Abby.
It's always nice to leave the department in a nice state for the next shift, but it's not very often that happens. I've only been a sister for just under a year. A&E always appealed to me just because I knew that it were going to be fast-paced and busy all the time. I didn't quite realise how busy and fast-paced it would be. Very exhausted after most shifts, but yeah, I feel like a job well done. Oh, lovely. As easy as that. Thank you very much.
Sister Abby can finally head home.
The sense of achievement and looking after others really makes me want to come back again. Everybody will look after each other after the shift as well, messaging each other, just make sure you're all right. It's a real sense of community down here.
And she'll be back working alongside that community tomorrow, saving lives and serving the people of Barnsley.
And we're back at Casualty next Monday at 9. And as dozens of men await their fate, we reveal the disturbing truth behind the crime, the Pellicott Racecape, a town on trial, brand new Wednesday at 9. A love affair at a stately manor leads to a shocking murder. Dalgleish is on the case Thursday at 9. Next, it's the Motorway Cops.